Hey guys, down here. This is an interesting. Um, I did with a doc here in Canada and Dr. Stern, and we went through the whole thing. We went through this whole process where I'm interviewing him about plantar fasciitis, and I'm teaching him how to take those and make them into assets, meaning how to take the videos, cutting them up, how to take the transcription and cut it up. And I'm kind of giving him the resources. And I'll put links underneath here if you want to know kind of what I taught him and some of the links I'm recommending on Fiverr and stuff like that to do these things. So kind of an interesting interview. You get to hear his discussion of how he treats things in Canada and also kind of how to make stuff out of it. Okay, hope that helps.
Yeah. Oh, can I leave the meeting or should I go continue? Here you go.
Okay, let's get going. Hello and welcome to Podiatry Practice Mastery. Today I have Dr. Stern and we're going to be asking him some questions so he can make some content. So simultaneously we're recording this on Zoom for videos, Otter for a transcription, and then whatever else he wants to do it for. So Dr. Stern, what causes plantar fasciitis?
So there's a number of different causes of plantar fasciitis. Also, I tried to say, is it more in the heel or is it more in the arch? 90% of plantar fasciitis is mechanical, the way your foot functions, inadequate foot support, tightness of your Achilles tendon, unsupportive shoes or incorrect shoes is huge, trauma. And then sometimes you also have to, if that's not your regular 90%, you have to look at other things, like it's probably more in the 10% category of low back issues, core issues, leg pain, nerve, even varicose veins has been, I've had patients who have had varicose veins and have pain in their heel. And then obviously arthritides. You need to, so you're not getting your results of in treatment with the normal, regular mechanical things, and you got to look outside the box there.
And how can someone be sure or determine that they have plantar fasciitis?
So other than looking it up in Dr. Google, I would look at going to your podiatrist, depending on how long it's been there, for a couple of days, or has it been there for a number of months? Acutely is in the first 3-4 months, and then becomes chronic after 4 or 5 months type of thing. I would see your podiatrist, and we give a full examination. So we're looking at you standing, walking, running, checking, get on the table, checking your ranges of motion, your muscle strength, and palpation. Feeling the area, putting, does it hurt here in the heel? Does it hurt here in the arch? Does it hurt on the inner side of the arch, the center part of the arch, the outside of the arch, the inner side of the heel, bottom of the heel, where it is. And it's a puzzle. We put it together. The patients give you the answer. You just have to figure out what it is. And you figure that out by checking. So diagnostically is the most important thing.
And what diagnostic things do you use to help determine that someone has plantar fasciitis?
So other than your
x-rays or ultrasound or things like that.
Right. So other than your examination, I think that x-rays are good, just to look at the foot alignment, the biomechanic, the position of the bones, type of foot. Everyone wants to know if they have heel pain, if they have a heel spur or not. I'll explain that in a second. Ultrasound's great. I like ultrasound a lot. It's easy to get. It tells you the thickness of the plantar fascia. It tells you if there's a tear. It's great. And if you're not getting anywhere, then next option would be an MRI. So a lot of patients fixate on the heel spur, that they have heel pain. And we have to explain to them that it's not the heel spur that actually hurts. It's just the syndrome that in that area, the tearing of the plantar fascia off the heel bone when it hurts underneath the heel. So patients go, I want that spur out. It's like, no, it's okay, because I'll tell them that some people have a spur that's triangular in shape, and the point towards the baby towards your toes, that could be 1.5 centimeters long, but it's just an incidental finding, and then a small one or barely any spur, and you can have massive pain. So.
What treatments can someone try before they come to see you in the office?
First off, change your shoes, because a lot of people wear shoes way too long. I mean, running shoes roughly last 300 to 500 running miles, 400 to 600 walking miles, or probably rubber sole shoes, not much more than 2.5 years in the ideal conditions. You know, patients say, I wear them till they fall apart. Well, that's probably 6 months or a year too long. Look at the bottom. I've had patients who come in and said, I have heel pain and have a hole right where the heel pain would be. And I go, well, it's your shoe. No, it's not. I've been wearing the shoe. It's never hurt before. Well, yes, but it's worn out. So shoes are massive. I would definitely do that. What also anti-inflammatories they could use, just oral or topical anti-inflammatories. A little bit of an exercise program. You know, strengthening the foot, rolling out the foot. A lot of people try different things. Some people are a little bit of don't want to try things unless they talk to the physician, you know, like a splint or depending on type of exercises. Another thing you can do is an insole, just getting an over-the-counter insole. And that really is quite helpful. If that helps, then we know that it's it's biomechanical. It's the way your foot functions. An insole over the counter, if it's a half decent one, is not the same as a custom orthotic, but it definitely gives a bit of support and comfort to the foot. I remember this young boy, about 10 years old, told me that his insole worked for about 10 days, but then didn't work anymore. Well, it's because it was just, he pounded it out super flat. So that kind of leads you to that's a biomechanical issue.
And let's talk, Dr. Stern. What is your unique method of treating plantar fasciitis? When someone comes in, you make the diagnosis. What is your unique method?
So I explained to them everything, all the different treatment options, which are probably at least a dozen or so that they could try out. I think that shoes obviously are number one. There's different, you know, once they tell them the features of shoes, how to fit shoes. So many people fit shoes small, too short. There's shoes like Hokas, which are these soft, stiff rockers, which patients, you know, who have standing jobs, they just love, and they're like, oh my God, these are the best things since sliced bread. I like them. I have them myself too. I have other shoes also. Exercise, I think, are important. You know, rolling the ball, a tennis ball. I don't find a hard ball, a tennis ball, or like up here, a hockey ball. In Canada here are good. Golf ball I find is a bit too hard personally. That's just my feeling. I think, you know, so strengthening exercises like toe scrunches to strengthen up the bottom of your foot. The you know, stretching out your calf muscles. You can roll your calves and you can, you know, roll the frozen ice bottle wrapped in a towel on the bottom of your foot, or like the ball, like I said. Those are all really good exercises. You know, the insole, if it's an insole works, then maybe we do a taping, or if not, go right to maybe a custom orthotic. You know, it also depends, like I said, how long. If you only had it for a few weeks, a month, a lot of times shoes, exercises pretty much help. If it's 4 or 5 months, now you're throwing everything at it, type of thing.
And let's talk about that then. What are some of those more advanced techniques if someone they've already tried those initial things and they don't get better? What do you do next?
So in conjunction with shoes, taping, medication, there's the orthotics, obviously. I work with a physiotherapy clinic, and have a few that I recommend, and also in a couple of my offices I work at a physiotherapy clinic. So I think laser is really great for the foot. Acupuncture, IMS, shockwave, extracorporeal shockwave treatment. There's been good success with that. Those are different things. And then I leave it up to the physio, because I don't think they should just look at the foot. I think the physio should look at the lower extremity. So from the low back all the way down, to make sure that the core, the hips, everything's in good alignment and strong, that they're not weaker on one side, you know, or a leg length. Looking at all those different things like that is very important. There's medications, oral, topical, then there's various injectables. There's cortisone, there's hospital here will do ultrasound guided prolotherapy, there's PRP. There's a lot of different stuff there. And here, it's not usually our first lines of treatment. Um, it's usually we try a lot of other things first before we go that far, not necessarily cortisone, but in the PRP and the ultrasound guided Prolo and stuff. I mean, patients have even been casted for arch pain because it hurts so much. And you
Mm-hmm.
also have to look, maybe you need to be casted because you actually have a tear. And that's where the ultrasound comes in, because sometimes, they're going along and they've been seen by a few people, but no one ordered an ultrasound and they actually have a tear. And they go in a cast for a month or two, and they're like, holy moly, I feel so much better.
Mm-hmm.
And
Mm-hmm.
then post, you put them in like in an orthotic. So those are a lot of different options. Night splint, I should say. Um, Sometimes I've had night splints. Patients have kind of complained about them because they pull their foot up too much. Then they end up getting like a numb foot. So they have to be careful, or if it wraps around their leg, they can squish the nerve in the leg. And so I always have to tell them they have to be careful with doing the night splint.
Mm-hmm. Mm-hmm. Why are orthotics so effective at treating foot pain, and specifically plantar fasciitis, in your opinion?
Well, the orthotics put you in a better, supporting your foot, take the stress off your tissues, the tissue stress theory. So they're giving you that control, comfort to your foot, um, aligning the foot in a better position. How much do they correct? Well, they're not letting that foot collapse more. They're supporting up that arch. We put a hole in the heel of the orthotic to take the pressure off the heel. So these are the things that you want, and with a guy, it's pretty easy. They could transfer one pair and ship and move them from shoe to shoe. A woman's a little, obviously, a bit more difficult because they have runners, they have low dress shoes, and they may even have high heeled shoes. A lot of times, plantar fasciitis heel pain does not hurt in high heeled shoes because all the stress is really taken onto their ball of their foot. But so you want that support, that comfort, realigning the foot, taking the excessive pressures off that area. That's where the orthotic.
Good, good. And what are some of the common mistakes that you see patients make with plantar fasciitis? I think you've probably mentioned a few of those, but what are a
Yeah.
couple of the common mistakes that people make?
Trying to run through it or exercise through the problem. It's not one of those things that just kind of goes away, especially if it's been there for a number of months. Like I said, a couple days, one day that your arch hurts, that's fine. Take a rest for a couple days and that's good. But a lot of times if you had it and you had like little bouts, it keeps compounding. And then maybe a few years later, you might get more plantar fasciitis where you can't resolve it in a day or two or a week. And it goes into lasting more weeks, months type of thing. So going back too soon, the shoes, which is huge, not wearing the proper shoes, worn out shoes, not doing their exercise. Oh, it's good, can stop now. Sometimes I tell patients, hey, I stretch my foot and roll my arch all the time. Just, it feels good. It's good for your foot. It's good for your foot mobility. Nothing wrong. I love the toe scrunches, so doing your exercise, just make it part of your life. I mean, we all know that stretching and strengthening is great for us in general. So why not just keep doing it for your foot? And also their gait, their stride. So if they're runners, their overstriding is not great. So a shorter stride, you'll take more steps, but a shorter stride gets you to run lighter and or walk lighter. Also. So I think that's also a big thing in your walking gait or
Good.
running.
What are a few of the misconceptions that patients have about plantar fasciitis? I think you alluded to one in terms of the spur. Are there any other misconceptions?
There's one treatment and it should fix everything. And why didn't you do that today, sir? And get that done. It's like, it's not. It took you 5 months to get into the office. It's not going to be one treatment. In the end, it might be the one thing that tipped the scales, but you've probably done taping, padding, shoes, physio, exercises, all those things. And then, they did some IMS and it got all better or something of that sort, or they, whatever. It's so, yeah, it's like that there's a pill for everything and there's not usually a pill for everything. And if there is the pill for it, then that's great and awesome. But a lot of times if you just take a pill, then it's probably going to come back. So you're not getting to the root of the problem. So you need to get to the root of the problem, the mechanics, the function, or is it an arthritis? And a lot of times if it's an arthritis, it's probably a combination of mechanics and arthritis, in my experience.
Mm-hmm. And are there some secrets for those that are listening, how they can speed up the treatment of plantar fasciitis? If they come and see you, what are some secrets you give people or those that are listening that want to learn more, some of these patients?
Um, again, I know I harp on shoes because that's what we walk on, and it's huge. Um, Following the guidelines, what we tell them, like, if you did get a new pair of orthotics and you're a runner, you can't go running on them. If I give them to you today, you can't go running on them tomorrow. You can't go running on them for maybe even up to 2 weeks or more or longer. It's a whole break-in period. And so they, an hour today, 2 tomorrow, 3 the next for orthotics. But you got to get used to them first walking, standing, and then running, because it's 1 to 3 times body weight with walking, but 3 to 5 times body weight with running. So doing things too much, not following your program. So speed, the stretching, the strengthening, most patients say that does help a bit. It's not going to solve it, but it takes off the edge. Other thing is using shoes at home, especially in the first few months, to try to get rid of it, or using your shoes with your orthotics at home, because some people just, I'm just going to use my orthotics at work in my my work shoes. But using them at home is big, because that's going to get you more used to it and better. And if you don't want to switch them around, or you leave your shoes at work, then at least get some nice sandal, like a Birkenstock sandal, something of that kind, Hoka sandal, to give you something for at home, because that's really important, because we do a lot of walking at home. Standing and walking, we do probably as much inside that we do outside, other than through an exercise program.
And then the last question, which I think we've addressed, I don't think there is one, but what's the newest or most successful treatment in your opinion? Is there a successful treatment that works great every time?
Yeah, like you, I don't think there's one. No, I don't think there's one successful treatment that always works, because if it works for you, it's not necessarily going to work for the next guy. I mean, anti-inflammatories work for one person, and then I just took some anti-inflammatories and that was it. It was all better. That's probably if they had it for 2 days, or a few days a week or whatever. I just think it's a combination. And I tell patients, it's like making a cake. There's a combination of treatments. I give them these dozen options that's there. And I said, we'll see how far we go down that list. We're going to keep adding things in. And I think working with other people, like, first of all, your imaging, here we do the imaging, we send them out. It's a government program. So we get the x-rays, the ultrasounds, the MRIs. And I think working with the physiotherapist, I think is big. Like I said, for here, I don't do those modalities in my office. So I work with them, and which is good, because we bring different thoughts and to help treat that patient. And then if you need to get into the rheumatologist, because there is an arthritic component there, so or the radiologist will do certain ultrasound guided injections for us in the hospitals here. So I think it's a little bit of everything, but never being not open to working with another group or getting a second opinion. Nothing wrong with sending them to one of your colleagues and say, hey, just double check this for me, because I've been doing this for 9 months and patients not getting better. Probably have looked at everything, and we all have had those kind of patients. And so second opinions, working with other groups, patients are going to like you for being open with them and telling them to, different testing, and you don't do that exam, or you don't do that treatment. I mean, they're cool with that. Go to this, my friend here, or my colleague here, or this other modality, and specialty, and have them do that treatment. I don't do it. We've tried 8 treatments and nothing's worked, so maybe we should look at that.
Cool.
Being open.
Good. We finished them all.
Wow. Pretty good, huh?
Well, this is the easy part. So the hard part is making content. And I think that's the purpose of this. So let me walk you through it.
Okay.
You can write it down if you want, but I'll send you a link.
Sure.
What I normally do, and I'll go through this. So you're going to get a long transcript with all this stuff written down. I like to pay people to do stuff. So you can do stuff, or you can pay people to do stuff. So let's first talk about the transcript. What I would do with the transcript, I'm going to send it to you. I'll put it in a OneDrive, just a folder. I'm going to put everything in a folder for you. You can have access to it all. And then what I usually do is I take that transcript and you can send it to someone. You can either use Fiverr, Fiverr, or Fancy Hands, either one of those. And what they'll do is you want to say, hey, you know, I want to edit this into multiple blog posts. You'll say basically each question is going to be the title of a blog post.
Okay.
And so I wrote them all down here. I'm going to send this at the beginning. I'm going to add this to the beginning. These are all the questions. So each one of these, they're going to put it where I asked that question as the title, and then they'll edit that to make an easier answer. They'll take out the ahs and the ums, and you'll probably pay them, I don't know, $20, $30. It depends on how long it takes them to do it. Or if you have someone else that can do it for you.
No, I'm cool.
So
I have to set up a Fiverr account?
Yeah, Fiverr, and just want them to do editing. And so you'll send them that document and you have them to edit it. And you have to be detailed what you want them to do. And so they would do that. The other thing that you'll get from me is this big video. So it's going to be one long video. It's going to be about 30 minutes.
Yeah.
And what you'll do is there's someone else on Fiverr, and I'll send you this guy's link. And what he does, and what I'd recommend, and I'll send you this as well. You'll make like a title slide, and I'll make that for you. It's like your name, question, and maybe your logo if you have a logo.
Right.
Okay. If you don't have a logo, just your name and the question.
Yeah.
And then what he'll do is he'll put the question up first, and then he'll add your answer to that question.
Oh, like the questions you wrote down.
Yeah. So he'll take the list of the questions. You have to give him the list, give him a slide template. I'll give you one. And then you'll send that to him, and it'll have the slide, and he'll switch out that, and then he'll just cut out me asking the question and just you answering the question.
Right.
And so he'll cut that into multiple videos. So you'll have like 12 videos on these 12 topics.
Oh, sweet.
So that's how you repurpose things. You'll have multiple blog posts, you'll have those 12 videos, and then it's up to you how you want to share that.
Right.
So that's how I make content.
So it really doesn't cost you anything. I mean, time, but.
Yeah. And if you can, I'm a big fan. You could take the transcription and edit it yourself. That's fine. If you have time for that. I just don't have time, and I'm not very good at it, frankly.
I'm not good at it. No.
So
I'd be frustrated and I'd lose it.
Yeah. And so that's why I figure if I can pay someone, and you have to find the right person. A lot of times with Fiverr, I might try, like, I'll try a person, give them a small portion of it and see how they do. Or I might try a couple of people, or you look at how many reviews, how many times they've done it. So within Fiverr, you're going to look at like how many gigs they've done. It's called gigs, like how many editing gigs they've done. And you might give it to them to try it. And you have to be, the key with delegating to others, which I have a hard time with, is you have to be very clear on the task. You know, I want you to do this and this and this, and then they can do it. So if you're not clear, you're going to get a shoddy answer.
So do you have the certain guy we're supposed to?
Yeah, I'll send you the video guy that I use. Right. And I've done some editing work. I usually do Fancy Hands for editing work, but Fiverr, I'll just keep with the same one. Because the Fancy Hand, you have to set up like a monthly account and stuff like that if you do a lot of delegation.
Right.
I'll send you both of those. I'll put all that stuff within this folder for you.
Wow.
In the asset folder. So I like doing it this way because it doesn't take me any time. It takes me 30 minutes and I can do a ton of content.
Yeah, it's crazy. That's unbelievable. I appreciate that.
Well, now it's up to you though. I want to see how long it'll take you to do this, because this is where I'm the bottleneck usually. So you might have a hard time finding someone, things like that. Just let me know. Okay.
But don't you want to be paid for this or something? Or
I want you to have success. And then if it works out, then maybe I'll be paid for it in the future. Maybe I'll make a course on it, right? I made my first course. Did you see that course I did?
Yeah.
On webinars. So you can buy my course. That's what you can pay me.
I just pay you in general. But you don't do the websites per se. You're just giving people ideas what to do.
Website. Now, website work, I use Kajabi. So if you want this might be going down the road. Like I've thought about, because you mentioned it, could you buy my books? And what I've thought about is I could white label the books. And I was also thinking with Kajabi, I can white label a site. But I haven't figured out, I don't have a who to do that for me yet. But basically I could set up like a mock site and just give someone that site, and it's all set for them. And because the thing is, if you do Kajabi, I get like $50 a month or something like that. So if you pay, let's say you pay 200 for your first site, it's only 200 a month for Kajabi. They pay me a kickback of like $100, like a referral fee,
Great.
$100 a month. So if you decide to do Kajabi, I'll give you my referral link. But with Kajabi, like, I don't know how to transfer my thing over to you. What, you know what I did? I can teach you what I did. If you
All right.
want a website,
Yeah.
I hope Jim's not listening. So if you can use Jim.
Jim's the website guy. I know. I talked with him.
Yeah.
Yes.
But if you want to do Kajabi, what you do, and
And
this is how
he's pseudo Canadian.
and this is how I did it,
Yeah.
is I purchased Kajabi and I went into Fiverr and I paid a guy $200 and he designed my site for me.
Oh, really?
Yeah, and it's much better than I could do. So,
Wow.
and I'll give you his contact as well. And
Yeah,
so,
I have a guy here who's already done in this site's pretty good. I have talked to Jim about it too, because he does more website stuff too, right?
so I guess the question for you is, if you can use any guy to do a website, that's fine. If you want to, the reason to do a Kajabi site, in my opinion,
Mhm.
is because it's not just a site. It gives you the opportunity to build a list. So on the site, you're going to offer your book and they put their email in there. And then you build your list, and you can take every patient that sees you, add them in there, and you can email them your monthly newsletter. You can email them you can sell products. You can do a lot of different stuff on that site with Kajabi. If you only want a website, then you just get a WordPress and it's less
Oh,
expensive.
I see. I see. So, okay, what is your relationship with Jim?
He used to help me with Podiatry Practice Mastery. So he's the one that did the Kajabi site for me on Podiatry Practice, but he's no longer with me anymore. He's doing his own thing. So
Okay, so
I'm free.
you're friends, but you're free,
Yeah.
but you're whatever.
Well, and
No, 'cause
so
I've talked to both of you because he does more in the web. Like my guy who does websites fine, and he wants me to do these videos. That's why I'm talking to you about all these videos and put content on my site and to keep you up there. And the site is pretty good. So it's, and I got a grant from the government. So I have some money I have to spend. Yes, the Canadian government, no, the British Columbia, the provincial government gave me a grant that I have to use the money in 9 months, and it's probably about 4 months away. Like sometime in February, I have to use this money. So it all started in researching it for myself, and then I was looking at podiatry content connection, whatever, and then I was in my research. I found you two guys, and I'm like, I like you two guys. You guys are really nice. I like both you and Jim. I was like, oh, this is but they're partners, but they're not associated, but they're friends. I was like trying to figure it out. And I love getting your emails and stuff. And so I'm like, that's why I started talking to you. And I was talking to him. And I was like, okay, so it became for me, then it started to be for the association because I used to be president, as I told you, and I'm in charge of member benefits. So before I actually found you two guys, I already talked to Podiatry Content. I've talked to them a few years ago, but so the membership wanted, or the executive wanted Podiatry Content. So we signed them up as a member benefits. It doesn't cost us anything, right? It just says, oh, member benefit. And they use my friggin' name, said that I think they're good, and that's call the story. And I'm thinking, but that's great, but I know these. So, and I said to our exec that I am working on these other two people too, and I think they're really both great people. I mean, I'm not really sure their relationship, but one guy's in Canada and the other guy's in the greater Northeast, not Pacific Northwest. Why you're called Greater Northeast and we're called Pacific Northwest? I never could understand that. But so that's how I was like, okay, well, what about these guys? They're good. He's Canadian. We should look at him.
I'm not a website guy. I mess around to give myself enough headache. Jim was doing the website. If I could switch, I'm stuck with Patient Pop. I would use Jim. Okay, yeah. I have Patient Pop. Jim does a great job if you want to grow a site. If you're in a private practice, he's in my opinion, he's expensive. He's about $2,000 a month.
Yeah. Okay. Yeah, he said it's up to $2,000.
So but that would be for a private practice that uses him for all the AdWords, and you need to build practice. Mm-hmm. Whereas podiatry content or in other like office site, they're probably a lot less than that. If you get it depends on what your needs are. Okay. Yeah. I'm more of the marketing mindset. That's why I like the Kajabi site. And so it's how involved you want to be. Like if you want to do it, like my way is hard work. You have to install Kajabi. You have to find someone on Fiverr that'll design it for you for a couple $100 or $300, $400, $500.
Yeah.
And you have to give them all the content that you
Right.
want. What a pain in the butt. Like
Right.
if you have another person that can do it, like podiatry content, they're probably fine. There's others that do it. Office Site is another one, you
Offsite.
know, and
I looked at offsite years when I first started, and I was
yeah,
like, $2,500, X amount of dollars per month, and you don't own your website. I was like, that doesn't make sense to me.
yeah.
My buddy used them.
So, and so there's a different ways, however I don't know what the end goal is.
Yeah. Well, I just think I just need some. I like
Well,
to
then,
do what you're doing ultimately. Okay. See you later.
all set. Thank you.
Yeah. I like your idea. I think just to get, because I have to use this money now, so it's not like I'm going to spend $10,000 every year. So like maybe put some content up, do some videos, and then next year and do this along the side, because I think these are great. I think it's a little bit more, it's quite personable for the patient.
Yeah.
I like this whole idea of what you just did. And
Yeah, this is super easy. You know how to do it now, and
yeah,
it's not complex, and you get the content. Now, I agree, the content's not perfect, but it's done is better than perfect. The one thing you have to remember, and I've made a lot of mistakes on this,
absolutely.
done is better than perfect.
There you
Done
go.
is, because we're perfectionists. Like with all that we do, we're perfectionists, and so like for these things, and the other key, in my opinion, is find who can do it for you,
Right.
because otherwise we're the bottleneck. Like for me, if I were you and you wanted to do a site, I would say go to Kajabi, download Kajabi, go to Fiverr, pay this guy, and he's gonna say, hey, what do you want on page 1, 2, 3, 4? All you do is you copy from other people's sites and say, I want one to look like this, one to look like this, one to look like
Right.
this. Put
Right.
those pages like that. Here's the colors I want. Do it
Done.
for me, and he'll do it for $400 or $500, and then your site's up and running. You just copy other people's sites. He'll
Right.
do it. He'll make it look just like that. That's, if I were you, that's the easiest way to do it. Go
Right.
plagiarize someone's site. No one heard me say that.
Pardon?
Plagiarize someone's site and send it to this guy. He's from India, and he'll do it for you.
Yeah.
And he'll go in and set it up for you.
Yeah. There you go. Yeah, I'm just more. I think this is
This
more
stuff.
what I need.
Okay, this stuff.
The content stuff, and get it going, and
Okay.
blow some money on the government, because I always have to pay it back. So I might as well do it, right? And then I mean, you pay tax on it, but you use it. It's an office expense. So here's your money. It's an office expense, and you got, like, I was given 15,000, but it's also and it's unfortunately started in September of 20. So a lot of the stuff I had done, like PPE stuff for like plexiglass and all that stuff, was in May and June. So, but I can write off masks, gloves, all that stuff.
So what can I charge you more for? How much you want me to charge you? Just give me some money. What do you want me to for?
I'll figure it out. When I get the last amount of money, I'll figure it out. Don't
Figure
worry.
out a way to pay me. I'll be happy to take some money.
You'll send me a thing, and you will do a little bit more, and I'll figure out. Yeah, if there's like 500, 1,000, 1,500 bucks left, because I just calculate. I've only spent like 2,500 bucks on PPE, right? Because the other 1,000 plus I've already spent already. But that includes wipes and all that kind of stuff. So yes, don't worry. There will be something there for you.
That's fine. I just enjoy doing this, as you can tell.
So, or we can do this a few times, and then I'll have more content. You can throw me some more questions, and then there you go.
Let's see how this first one. Now it's up to you to do your part.
Okay.
Okay, that's your homework. Let me know when you're done.
All right. Appreciate it. Have a good weekend. We'll talk soon.
Okay, Joseph. Bye-bye. Thanks.
Bye-bye.